We will move to the next, the last session, and that's really, we are late 10 minutes. That is an interactive session, and we heard from Dr. Osama Ahmed yesterday, and he gave a brilliant interactive session. And today we will continue this session. I will introduce Dr. Mohammed Osama for those who were not here. Dr. Osama Ahmed Hassan is an associate professor in One Health at Umeå University, Sweden. He is also a consultant in One Health and health security with the Global Health Program at Chatham House in the UK. Osama has over 20 years of experience, and his work is mainly based on research and teaching and services at the human, animal, and environment interface. So it will take us through the step to address zoonotic disease in terms of detection, response, communication, mainly based on principle of communication and based on his experience in Middle East and European Union as well, and with different viral diseases. Okay, over to you, Dr. Osama. Thank you.
Thank you so much. Thank you so much, Dr. Tieble, for the introduction. And for those who attended with us yesterday, we will continue with the same case study because you know that, and we discussed that yesterday, that risk assessment, a part of the risk assessment is risk management and risk communication. So the story did not end yesterday. Possibly it's going to be continued, but after the risk communication, there must be risk documentation. That's not our focus today. So our focus today is risk communication. Let me just share with you an important slide at the framework and background for the session of today. So for any communication process, it looks like that. Here we are talking about risk communication. There is sender, and in our case of zoonotic diseases, there are going to be like a lot of sectors, and there is receiver, and those the receiver could be also in like different stratum, different groups, educated, non-educated. They could be in urban setting, rural setting, and nowadays also they could be like a global city. There is a media between, trying to facilitate the message between the sender and receiver, and there will be, of course, traditional media. There are some social media, and there is a message. And between the sender and receiver and the message going in between them, there might be noise. People talk about this, rumors and infodemics and stuff like that. But also there could be, during the process, a feedback from the receiver. So this feedback will allow us actually to take the corrective decisions if the message is not well received. Okay, this is the framework of my case study of today. I'm going to go back to our case study of yesterday, and I'm going to maximize it, and then we will read it again, and we go for the questions. So it's about risk communication for zoonotic disease outbreak in East Africa. So there is a rural village in a remote region of country X, and the village is located near the border of country Y in East Africa. And the animal breeders in the village cross the border of country Y and sell their livestock at country Y market. The area is known for raising animals and practicing agriculture. It is a part of the region that provides the whole country X internal market with livestock and exports to Gulf countries, particularly Saudi Arabia, to meet the significant needs during the Holy Muslim Hajj season. So in year X, there was a heavy rainy season in the village. And after 1 month of heavy rain, rumors spread that many persons developed febrile illness, while some have died. The symptoms in human were described as headache, fever, and influenza-like disease. The rumors indicated sickness and death in animals as well. The media reported that 30 persons fell sick and 5 died. However, the report did not provide further details of cases and diseases in animals. So with this background, we would like to start discussing this case study around the risk communication principles. And I would love to hear your voice, at least at the first 2 questions, if you are interested. So what is the relation between risk assessment and risk communication? Could someone help me with that?
Just jumping in to remind the participants that if you'd like to speak, they can raise their hand and we can unmute them. And to not be afraid to speak, but please do. Or if not, if you'd like, you can always use the chat function.
Okay. So what is the relation between the risk assessment and risk communication?
We have someone with their hand up. So it's Fatul Ndoye. I will allow you to talk now.
Good.
Good morning, everyone. Are you hearing me?
Yes, go ahead, please.
Yes, for me, a risk assessment is when you do the evaluation, the research in the field to have information about the risk. And risk communication is when you got the data now, you communicate the risk, the strategies and how to communicate risk. Thank you.
Thank you so much, Fadil. Indeed, risk communication simply inform the evidence-based risk assessment informs the evidence-based risk communication. So in order to have evidence-based risk communication, you need to have outcomes, findings from the risk assessment. In another way, you wouldn't have a proper risk communication without having a proper risk assessment, and they are fully interconnected. Let's have a brainstorming sessions also here. So what factors make risk communication during an emergency like this outbreak more difficult compared to an emergency setting? If your thoughts is me. Take some for those who share their thoughts about the relation between risk assessment and risk communication. We move now for the second question. What factors make risk communication during an emergency like this outbreak more difficult compared to an emergency setting? So if you are doing risk assessment at this time, when you do like a priority or zoonotic disease and you just want to communicate risk, it's not an outbreak setting. What is the complexity and difficulty associated with this kind of risk communication during an outbreak compared to the one that I described? Yeah, in the chat box, misinformation, rumors, perceptions, yeah, sounds okay. False information, yeah, which is called sometimes infodemics. All time.
Hi,
Yeah,
we have someone who raised their hand. We have
could you stop writing in the chat so I can touch up?
We have someone
yes, I want to ask the people in the chat to stop.
Yeah, so we have
writing.
Leslie here who'd like to talk.
Yes, go ahead.
Leslie, when you're ready, you can unmute.
Yes, can you go ahead?
Yes, can you hear me?
Yes, please.
Yes, so I was just going to say that one of the main problems here is the time constraint, because in an emergency situation, there's time constraint. So the need to actually go and prepare your information is very important, and how to communicate the information in the right manner. And then the other component is also how to ensure that calm is maintained. In an emergency situation, there's always some kind of panic and some kind of fear, and ways of people is escalating. So how to control that kind of panic and fear whilst communicating the information in the most amicable manner. To me, those two elements are some of the main challenges. So some of the big challenges when communicating risk information during emergency situations.
Thank you so much. Thank you so much, Lizzie. I strongly agree with you. These are two important factors. The first one is time pressure, time constraint, as you said. And the second thing is also the spread of anxiety or the fear. And this also has been mentioned by many of your colleagues in the chat. In addition to that, the unpredictable situation. We are not sure about the situation. Outbreak situation also is associated with social and economic disruption, which made it also hard for us to deal with the situation. Within the outbreaks and the pressure of time, there is cultural and behavioral values that might impede the risk assessment efficiency, and we saw that in COVID-19, hesitancy and many things. In addition to that, also the involvement of many stakeholders that will not make it easy. There is a lot of people who have interest in the outbreak, either to disrupt it or in different ways. Their interest could be varied. So those are the important factors that make the risk communication during emergency setting more difficult compared to. Okay, so just during the presenters, they really put the good basis for this case. So could you suggest some of the general best practices that make any risk communication successful? Just share with me the best practices that make any risk communication successful. So look at the chat, help me. Yes, so now we move from the factors. Now we move to the best practices that make any risk communication successful. So this is just like a brainstorming before we go deeper to the case study. Working with community structures. Okay. Trust. Yes, trust. This was mentioned by at least two of the presenters earlier. So the first things that you absolutely need to build trust. But before that, I would say plan in advance. Whenever we put the risk communication in our system, and we know how it will work, and the channels that will work according to the setting of the emergency, this will help us actually to do it in a very good way. And with regard to trust, building trust, you have two options: build trust and win, or don't and lose. There is no third option. More best practice could be being transparent. So the greater transparency that you have, the greater result, the higher trust that you get. And finally, I could say also respect the public concern. There is a lot of actually concern during the outbreak from different stakeholders. So you need actually to respect the concern of all of these people and try to find a way to touch upon this during your risk communication method. This, the organization, collaborations, teamwork, all of those could be also possible issues, but I try to highlight the most important best practices. Okay, should the risk assessment team at this stage of the scenario should include risk communication specialist or officer? And whatever your answer, yes or no, please justify it. Tell me. I'm going to go back to the scenario here. At this stage, with these rumors and this sick in and human and animals also, should we include a risk assessment officer or specialist at this stage? So, yes. Okay. Please attach the presentation material. Yes. Yes. Okay. We agree. Yeah, let us help me and justify your answer. Okay, I got it. All of you said yes. That's great. Why? Yes, because to collect proper information, you should have communication specialist. Okay, yes. Well, who is else could say this helps to build trust and confidence of community, lead and technical team. Okay, we do not have any much information right now at this stage to communicate with the local community or the national community. What this communication specialist is going to do at this stage. So what will be your risk communication approach during the first 24 hours of the mission? Now we have had just rumors and information and we're trying collecting something, but we do not have any solid result in our hand. So how the risk communication would be? Within the first 24 hours, imagine that you are there, you deploy to the, you will be able to communicate the intended message adequately. What is the message would be at this stage? We are not sure, we did not confirm the outbreak so far. Okay, the first one, Scott, allow the first one to speak if there is someone want to share.
Great. Yeah, there's Simeon Mogaka. I see you have your hand up. If you'd like to talk, please go ahead. Simeon, if
Here.
I cannot hear him, so I'll go to the next, which is Emmanuel Okunga. If you'd like to talk. Oh no, I hear Simon has unmuted. Go ahead, Simon.
Sorry, I raised my hand to respond to the very first questions earlier, but then in this case, I think it will be convenient for one to have a communication expert because.
Okay, sense. That makes sense.
Sorry?
You said you raised your hand for the previous question, so thanks so much. Maybe someone else can take the question.
Okay, I'll try with Medlin. You're the next one. Please do unmute if you'd like to talk. Medlin?
Yeah, hello.
Thank you.
Yeah, so this is Medlin. I'm from Sierra Leone. Just probably to make some comment on this risk communication. So one of the things that I mentioned in the chat box was absolutely to involve the community structures. Because involving community structures could be one of the very good way for you to build trust within the community people themselves, and it will absolutely provide the opportunity in order for the communication specialists to address their individual minds, their beliefs that they have about any outbreak, and this will definitely enable them in order to see how they can as well equally ensure to precautionary measure or to prevent the risks with the community people are being predisposed to, because it really needs to be a people-centered approach, and this will definitely be useful. And in the area of this, you will as well equally definitely see that their individual behaviors and practice will definitely change, and which will make it very easy in order for you or support in the control of any possible emergency that may happen to occur. Over to you.
Thank you so much. I will take it further from here. Yeah, thank you so much for your contribution. Yes, I can see that also in the chat. Some of you said that the capacity building, the risk communication should start thinking of how to build the capacity of his or her risk assessment team. And someone else said that there must be like a time for mapping and identifying the stakeholders who are important in the risk communication later. That would be great also. And once we have uncertainty about the disease so far, I think the risk communication could be also about the process that the risk assessment team will take. So if you provide the community with information that what this team objective is and what they are going to do, and when the final result will be communicated with them, and that they will be involved with along the process, that would be also really great. And once the team also get sure that this was in the place in the village, they could also ask the people try to at this stage at least to avoid possible contamination or risk of transmission from dead animals or human. At least that they have to be vigilant. So they have to increase the sense of vigilance within the community. Let's go further. And how do you deal with the rumors through your risk communication strategy? You know, this outbreak started with rumors and media and rumors. So you're not taking the lead so far. So how you are going to deal with the rumors through your communication strategy at this early stage? The communication to this population, is it important? Yes. Yes, include help build trust. So could someone help me to what is the strategy to avoid this to deal with these rumors? I think someone wrote in French, built on evidence. Absolutely. So if we have an evidence, we should just build on evidence to fight these rumors at this stage. But we do not have any concrete actually results so far. This is just the beginning of the outbreak, but still we need to deal with these rumors. Yeah, social media literacy, that depends on the context of the setting. This is rural village. I'm not sure if they have a social media or not, but if they have, that would be great. But maybe if you are talking about the channel, maybe radio, that might be very relevant to that setting. But for the whole of the country, of course, we can use social media and radio. Implication to rumors, implication to the allegation to, I have to brush my French today. Influence me to do the own information. Absolutely, all right. Indeed, all of this inputs looks okay, but anyway, you need to actually deal with this from the beginning. You need to know that this outbreak started with rumors, so you have to build actually strategy to deal with these rumors. Yes, you need to provide people with solid fact, but if the solid fact is not in the place, at least you will communicate with people that we are in the right way to create the evidence-based outcomes, and then we will come back to you and just take them along the road with you. So you have to fill the gap. Otherwise, the rumors is going to fill the gap, and instead of taking the lead, the rumors will take the lead, and also media and influence. What will be the content of your message? I think, responded to this question at this stage. How do you work with the media? That was the rumors. But media also has been involved in this situation at early stage, and media reported actually. So how do you deal with the media at this stage? You need to put also creating awareness, okay? Awareness for the society. But what about the media? Press conference, excellent, you made it, Fatoumata. This is also could be one of the ways to have like a press release, press conference, anyway that dedicated to this media, giving them the right information, and also build a continuous channel of communication between you and them, and allow them to get the right information from you, not from any other source. This is really important. Yes, and in order to enable the media, to convene the message correctly, you need to actually provide them with the right information. So first of all, find a way to provide them with the right information, and then they can share the right message to the. You can also train the media, of course, but the time is short. Usually, this is done during peacetime, as mentioned by Kasserine, I think earlier. Okay, let's go ahead in the scenario and see the related question there. The risk assessment team was deployed to affected village to investigate the possible etiology of this suspected disease. The team started gathering information and interviewing the patient and their families, as well as the families of the dead people. The team recognized that many of the men patients were working with animals as breeders, while the women patients were taking care of animals at home. Among patients, there were also persons who lived in the same village but had no contact with animals. On the other side, the veterinarians listen to the rumors from the villages that they have noticed an abortion in ibis and this in lambs and calves in the area. The villagers were reluctant to talk to the team, and they were concerned about their animals to be quarantined in the area and even to be killed. Okay, now we have more information with this case, where the risk assessment team collected more information and gathered some observations, both at the human side and animal sides. What are the sectors should contribute to the risk communication message at this stage?
I have a
So we
hand up
have
here.
people working with animals. Okay.
So should I, Emmy and Kama, I see you have your hand up if you'd like to unmute. Emmy, can you, there we go.
Yes, I can hear. I think it's okay. I'd put up my hand earlier on when the question was on the on the stakeholders.
No worries. Would you like to answer this question? If not, I can ask someone else.
Well, I can. Which the last one, the first one?
Yeah.
What are the sectors? Yeah?
Exactly.
What sectors? I think there will be different sectors would communicate to risk communication message. One such would be the media itself. In our instance, I could think of even just a newspaper or a Daily Mail to communicate in risk communication messages.
Okay,
that will be my submission for now.
Yeah, thank you so much, Amy. Is there anyone else? Okay, let me have a look at the chat also. Yeah.
Yeah, I have. If not, Rachel.
Yeah.
Rachel Lucadi, if you'd like to say something. Rachel, if you want to speak, please unmute. If not, I'll move to here we go. Go ahead, Rachel.
Bonjour. Allô?
Yes, we can hear you.
Oui, allô, bonjour. Oui, j'aimerais participer. Oui, je voulais dire ceci par rapport aux questions qui étaient posées aux secteurs qui devaient participer en ce qui concerne la création de messages. Je pense que la communication des risques va de pair avec les médias. Les médias qui restent un partenaire incontournable dans ce qui concerne la communication des risques parce que cela implique directement la population et quand on communique en tant que spécialiste en ce qui concerne la communication des risques sur les maladies zoonotiques par exemple, on aura plus besoin de l'implication de la population d'abord parce que c'est la population qui devient notre partenaire, on doit créer la confiance. Et aussi, on doit les écouter pour pouvoir y remédier aux solutions adaptées à leur niveau de vie, bien à leur communauté, tout en ayant les des autres.
Yeah. Thank you. I got your point. Thank you. Yeah, thank you so much. I got your point. Thank you. Okay, so let's take it with regard to the context itself. We said that now there is information about humans, dead humans, and also sick humans. We have information about animals, dead animals, sick animals, and aborted animals. And in this case, we need to include absolutely human sectors and animal sectors, as many of you said in that. And yes, media would be, but we need to remember that media will not communicate something from themselves. They need to communicate evidence-based issues from the technical people. So media is a channel depending on the joint body. one important point also, I don't think that the veterinarians are going to just communicate separately and the human sector separately, and if there is any other sectors, they will do separately. No, they have to have a joint body so they know that what is the message will be sent to farmer, what is the message will be sent to animal breeder, what is the message will be sent to the whole of the society, and so on. So anyway, the joint body should agree about how the risk message should look like for different groups of people here. And of course, the community leaders, as someone also said in the chat, it's quite important to include here. So what about the stakeholders to partner with you to support the risk communication? So community and community leaders is one of those partners. What other partners? Media, you mentioned, also could be also partner. Do we have any other partner more than community and media that we need to partner with to support us? Yes, you can write in the chat box. Yes, public health emergency committee, media. Yes. Yes. Yeah, local authorities. Yeah, local authorities, absolutely. Yeah. Yeah, we already put in place Ministry of Health, Ministry of Animal Resources, and community leaders and media. So yes, NGOs, excellent, and also technical organization. If there is any country office of technical organization, and in fact that you need a technical support, so they can be involved with, and they could be a great partners. In fact, what is the forum? What will be the content of your key risk communication message at this stage? The team recognize that many of men patients were working with animals as breeders, while the women patients were taking care of animals at house. But also among the patients, there were also persons who lived in the same village but had no contact with animals. And the veterinarians also noticed that there was an abortion in animals. According to this initial symptoms, what will your risk communication message content or focus be? Okay. Environmental health specialist and inspector. Okay. So my focus right now on this question. So to verify the disease is zoonotic or not. Okay, so then you will communicate with people that at this point, what with the initial information that we have had, that many people contacted with animals, contracted the disease. So we recommend you at this point to be careful in dealing with animals, and also while dealing also with aborted animals. Yes, there are some patients seems to be have nothing to do with animal contact, but still they develop the disease. But at this point, we don't know how they contracted the disease. So further investigation needed in order to identify the reason behind this. But also we need to confirm this by doing analytical studies to confirm our hypothesis that it seems to be the disease is zoonotic. Yes, so someone said the risk communication should include action to be taken, and this is what I was trying to say about the protection themselves and others from contacting the infection by getting closer to the animals or aborted animals. Exactly, communicate risk related to animal handling and human interface. Yes, use local communities. Indeed, let's go ahead. What are the possible barriers to deliver the risk communication message in this context, and how do you overcome them? In this context, would you expect any barriers to deliver the risk communication? Poor communication? Well, I can't see anything was mentioned with regard to poor communication here. Culture and beliefs, yes, this is one good. Knowledge gap also, absolutely. Language, we need to have interpreter with us. This is very important. Culture, cognitive and considerations, okay. Bad publication. So far, we didn't mention anything about the bad communication. We are trying to follow a scientific approach. But of course, if you have a bad communication, that will have consequences. Level of education. Yes, you need to consider the level of education. But if you look for the context of this emergency event itself, we said earlier that there was like a death of animals, and also the villagers were reluctant to talk to that team because they are worried about their animals to be quarantined and even to be killed. Those things are important barrier factors could be. So you need to decrease the fear of these people. You need to inform them how professionally the veterinary authority will handle this, and that they will not end up with an unfair quarantine or killing of their animals. Although the reality in Africa, because Rift Valley fever or most of these zoonotic diseases, having a problem with vaccination, it's not for free. There is no agricultural insurance. It will be very difficult for the team. If I'm a part of that team, I'm not sure how I'm going to convince these local villagers unless there is a well-established system of agricultural insurance and those things. So you need to deal with this anxiety of the owners of animals, and because it's clear that animals play a role in this outbreak. Yes, we will come to the issue of resistance to change or lack of motivation. Yes, they will have a lack of motivation if they are not sure of how you are going to handle their animals. Are you going to quarantine them? They will not have pasture, food, and water for their animals if they are restricted in this small area. If you are going to kill some of their animals, how you are going to compensate them? If they don't get answer for this question, it will be very difficult for them to comply with you. Okay, let's go ahead. So during the mission of the risk assessment team at the village, they found that some of those who have developed fever and flu-like disease recovered in a few days. However, some of the patients have been seriously sick and sent to the neighboring health facilities. And later, after a few days, some of the hospitalized patients have developed signs such as petechial hemorrhage, gum bleeding, meningitis, ocular problem, and even renal failure. So within 2 weeks, the total number of the patients reached 50, including men, women, and students at school. And the total population of the village is about 2,000. On animal side, more deaths in young animals and more reported female animals have been detected by the veterinarians. Biological samples were taken from human and animal and sent to public health laboratory and veterinary laboratory, respectively, in country X. So what is your risk communication focus will be at this stage? Now, more information disclosed that some of the patients developed just like flu-like disease and recovered, but some of them have had complications. These complications included petechial hemorrhage, gum bleeding, meningitis, particularly within those who have been hospitalized, but also some. Not only men and women, but also some students have been involved in this disease. And there is more aborted animals observed. Okay. The real-time exchange of information, advice, and opinion. Okay, what kind of advice and opinion will be your focus? Assessment to find out your strengths and weakness. Well, I'm not sure if this would be our focus at this time. To detect passages from biological samples. Okay, of course, we send the biological sample to the lab, the specimen to the lab. We will wait for the result. I think the focus should be here more on how to provide proper infection prevention and control message, because it seems to be that there is a hemorrhagic fever signs or symptoms. And many of these people hospitalized in hospitals. What does that mean? If this disease is like a nosocomial disease, that means this patient can easily transmit the disease for other patients. And particularly if there is another department where a patient has a problem, immunity diseases problem, that would be really difficult. And in addition to that, we need to actually recommend strongly for the medical and paramedical to use protective equipment, personal protective equipment. Indeed. So, of course, at that time, at early stage, we advise the people to avoid animals and also not to consume their product, because still we were not sure about the disease, but there was a preliminary evidence that the disease is some extent associated with the disease, but we need to confirm that so far. Okay. So the focus mostly here, because it seems to be this is a type of hemorrhagic fever, the focus would be infection prevention and control, both at the community side, at the hospital setting sites, and also medical and paramedicals, ambulance uses and equipment and so on. And also the samples that will be taken, the risk communication is not only for, sometimes we need also to remind them, the medical staff also, because they are working under high stress. Could be just like, it could be also like a guidelines for them at that difficult time to remind them about that. Okay, let's go further on the scenario. So after 1 week, the veterinary and public health laboratories confirmed that this was Rift Valley fever infection in both animal and human respectively. And this is the first time the disease was detected in country X. However, Rift Valley fever has been detected previously in other neighboring countries where strict measures have been applied, there including livestock export embargo at that time. Okay, the scenario is clear right now. Now the disease is confirmed as the Rift Valley fever. Now, at this stage, how to formulate risk communication team to deal with the situation. The whole of the information about the disease is clear. So I don't think one risk communication officer or specialist can handle the whole of this challenge. So how we are going to formulate a risk communication team? Okay. One health team, yeah, sounds good. Thanks, Dr. Huda. Indeed. It would be good to have a risk communication team shaped by One Health. Absolutely. That means including all of these sectors together. What is your key message, key risk message at this stage? The disease is known right now. What are you going to communicate with people? Now we have the disease, and we know we need to communicate with people the clinical signs of the disease, so they know that if they get sick, we need to provide them with information where to go if they need to test themselves or to get treated. And we need also to communicate with them the risk factor so that they avoid themselves. Absolutely, we need to communicate with them IPC's measures, infection prevention control. We need to communicate with them the control measures that need to be taken in order to avoid contracting the disease. If there is anything related to the public hygiene and issues like that, we need absolutely to deal with all of these things. So now the risk communication should be a bit wider, but still it has to be focused and concise, and the team has to find a way to formulate this concise risk message. And in general, we need to create the awareness, absolutely, and to make the community or the society to allow them to take informed decision about themselves. to protect themselves from the risk of the disease. Who is your target audience at this point? The disease is known at the village right now. So who is your target audience with regard to your risk message, risk communication? Okay, animal breeders, the society, it's just like community leaders, community. So are we talking about the society or community of the village? Yes, the people in the village. What else? In the background, we mentioned that you know that this disease has something to do with animals, and animals can move. Yes, students were among the vulnerable groups. Then we can also communicate that at schools. Country as well, indeed. So country as well. Well, what about the fear and the anxiety will appear there also there in for example neighboring countries, because this country having animals crossing the border to country Y, and this country also exporting livestock to Gulf countries in the scenario. So do we need to decrease the fear of those countries or not? I think we need. And in this case, we can find a way to collaborate with international organizations, the quadripartite. They can help us actually, the country can help the country to formulate this information and what measures are in the place actually to curb Rift Valley fever from moving ahead and crossing the border to other countries. So it seems to be that the level of the target audience here is a bit bigger with this disease. It's not only the local community; it's the whole of the country, because this village contributing significantly to the internal market of the whole of the country, and in addition to some neighboring countries also. So that's why we need to consider all of those. Okay. And what are the activities that can be done to change the risk behavior of the people at risk, at risk groups? Because by knowing this is Rift Valley fever,
Osama, I have Carl Mahmoudzi who has his hand up.
Okay, go ahead, please.
Osama, yeah, do you hear me?
Yes, I hear you. Go ahead. What are the activities
Carl,
that can be done?
sorry, 1 second. Carl, are you able? Yeah, if you can unmute, please go ahead. Carl, if you'd like to speak.
Oui, merci beaucoup.
Okay, I think we can move on.
Merci
yeah,
pour la pertinence de la formation. Avant de répondre à la question, je voulais un peu suggérer qu'on dirait on parle que des animaux domestiques. On parle que des animaux domestiques alors que dans cette palette des maladies zoonotiques, la plupart des maladies comme la variole du singe, la maladie à virus Ebola sont des animaux sauvages. Et on n'a pas tenu compte de chasseurs, par exemple, qui amènent la viande des brousses vers la communauté. C'est un peu ça que je voulais parler. Je ne vais pas éterniser la parole. Merci beaucoup.
Yes, thank you so much. So okay, for those who do not know much about Rift Valley fever, it's a viral disease, and the disease mainly affected animals, livestock. No evidence for pets, and from livestock like cattle, sheep, calves, and camel, and sometimes also like buffalo. The disease can easily transmitted to human by direct contact between infected animals and humans, or by consuming infected product like milk or meat, possibly also, and by mosquito from animal to human, and also from human to human by mosquito. So coming back to my question, what are the activities that can be done to change the risk behavior of the at-risk group? First, the at-risk group that we talk about, those people dealing with animals, particularly either men outside or women taking care of animals inside. So we need to find a way to discuss with these people. We should have like small focus group discussions or any way that we could see it reasonable in the context of that country. But the problem, those are not only the risk group people. The public also who do not deal with animals could be under the risk of rift valley fever because the vector aspect. So in this case, we need to tell the people that they can be also infected by some types of mosquitoes or vectors. So they need to protect themselves. The message could be in different way. Like they should use like impregnated mosquito bed nets. They can also wear long sleeves, and they can use mosquito repellent, and so on. Of course, there could be also a vector control in the area, but that could be also costly. But we have to be very careful. We cannot kill all type of vectors because this is an issue with that biodiversity. So we have to be really sensitive and careful. We need to run a proper mosquito surveillance to identify what type of mosquitoes are involved there. Also, when we know the type of mosquito, we can know the behavior of the mosquito because some of the mosquitoes just being active at night and some of them being active at afternoon, but mostly for the type of Rift Valley fever, they are mostly active at evening and night. At this stage, what is or are your risk communication channel?
Okay, Dr. Osama Ahmed?
Yes.
Yeah, okay, we are running out of time.
I think I'm about to finish.
Please, can you wrap up?
I think I have, no, I think I still have 4 minutes and I'm about to finish. Yes. So, who is your target audience at this time? I think we discussed that earlier. We have a variety of target audience inside the country or also outside the country. How do you engage the local and national community to comply with the risk communication? How do you engage them? I think if we follow the principles that we talk about, the best practices by building trust, being transparent, announce at early stage as early as possible, and respect their concern, you will be able to engage them. And the challenge part is how to deal with the concern related to economic consequences of Rift Valley fever in your risk communication. I think this should really be a very important part of the risk communication. Otherwise, it seems to be this country is agricultural-oriented country. So the livestock trade is big there, and there is a big chain around this livestock trade. It's not only those who raise animals, but there is markets, there is slaughterhouses, there is a lot of partners. Sectors involved in this. You need to find a way to communicate with all of these people because this is going to disrupt their economy. It's going also to disrupt the issue of the food chain and security of the country if meat is a part of the main source of food for the people there. And finally, the last question, how to determine that your risk communication is successful during and after the outbreak. I think Catherine touched upon that area. Could anyone help me? It is almost like a monitoring, an evaluation. Okay. I thought I should have up to 55, but yeah. Anyway, the last question is all about monitoring and evaluation interventions. At some stage, you can look and see if things going in relation with your objectives. If your objectives are achieved well, the people are complying, that is good. If not, then you should find the gaps and act accordingly. By this, I would like to thank you so much for your active participation. And back to you, Dr. Tieble. Thank you, Tieble.
Okay, thank you very much, Dr. Osama Ahmed. I think I just sent you a text for extra 3 minutes, but we are okay. We are on time. It was very interesting and interactive as well. And you have seen all of you how the communication is important. And now the communication between the risk assessor, between risk assessor and risk managers, and risk assessor and community, and the role of a specialist and expert in communication is very important. So thank you again for your active participation in the second day of the workshop, especially in Friday. And the record of this session will be available. I think you received the link already. If you haven't, be patient, you will receive it through email list probably, but the best is just to take from the link here. And so the presentation will be available as well for those who participate, and more than 80%, they will have the certificate. And so I will request my colleague Adam and Scott to provide those certificates, because one of the participants is still waiting for his certificates from the previous session, probably last year. So the evaluation form will be sent to you via email. So this is a good network building process. So you can even request the presentation if you haven't received. So, and then that will be sent through automatic certificate email, especially your certificate. Okay, again, thank you very much. For any other issue, you can really email, send your email if we don't have it. And for future workshop, you will be informed. Thank you very much, the great presenter, and thank you very much, organizer and participant. All our best wishes to you. Thank you very much.